So, do you have overactive bladder and you can't tolerate the medications, or they're not working as well as they used to, or they may not be working at all? Some of you may even be on 2 medications for overactive bladder. Well, this may be a good option for you. Sacral neuromodulation has been around since, year 1997. It was first described for urgency, then urgency incontinence frequency, and then in 1998 for even an underactive bladder. So how does this work? Okay, I don't think anyone really knows, okay? But I will tell you that since it works on both an overactive bladder and an underactive bladder, probably the common denominator is what it does is helps the signal. See, when you were born, you didn't have to learn how to urinate. It was a reflex. The bladder fills up, the messages go back to the spinal cord, then there's a message sent back to the bladder that says, go ahead and let her rip, okay? But over the first 3 years of life, you actually learn to control that, called toilet training. Now, the problem is as we get older, you don't have to be old, but I mean, as you get older, there are a lot of things that can go wrong with this whole system. Remember, if it relies upon the communication from here down to there, if you have herniated disc, if you have spinal cord problems, if you have any type of neurologic diseases, it interferes in the communication. And what happens? The bladder goes back to working by reflex, and you don't have control. So this strengthens the signals that are coming from above and helps you control your bladder better.